Can garlic control high blood pressure? Hypertension. Garlic is considered for a multitude of disorders and illnesses besides hypertension because of its properties. High blood pressure, the pressure or tension exerted by the blood on the arteries and the venous blood vessels, is called blood pressure. Normal blood pressure is less than 120/80 mmHg, where 120 is the systolic blood pressure (CBP) and 80 is the diastolic blood pressure (DBP). High blood pressure occurs when the blood is pumped by the heart through the system that is abnormally fast and powerful. Prehypertension or borderline hypertension is when the systolic pressure is between 120 to 139 or the diastolic pressure is between 80 and 89. Stage 1 hypertension is when the systolic pressure is between 140 to 159 or the diastolic pressure is between 90 and 99. Stage 2 hypertension is when the systolic blood pressure is around 160 to 179 and the diastolic blood pressure is from 100 till about 120. Stage 3 hypertension is increased blood pressure when the systolic blood pressure is more than 180 and the diastolic blood pressure is more than 120. High blood pressure is of two types: essential hypertension or primary hypertension, when increase in the blood pressure or hypertension is not due to any underlying disease process. Secondary hypertension, when hypertension is because of some other disease or illness, such as an underlying kidney disease or a heart block, it is known as secondary hypertension. Factors that can contribute to primary or essential hypertension. Most of the associated causes are because of lifestyle problems, such as 1. Stress and tension. In the fast-paced environment that we live in, stress and its associated problems are a common cause to increase blood pressure. This is more in type A personalities or in people who are high achievers. 2. Smoking. Nicotine in cigarettes and tobacco increase BP blood pressure. 3. Obesity. Obesity has the maximum contribution in increasing BP. This is because the heart has to work more to keep up with the increased body mass, which requires more blood for the supply of essential oxygen and nutrients to tissues in your body. 4. Sedentary lifestyle. Lack of physical activity or a sedentary lifestyle tends to increase the heart rate and makes your heart work more. 5. Saturated fatty acids in the diet can also result in an elevated level of blood pressure. 6. Alcohol. Excessive alcohol intake increases the risks of hypertension. 7. Elderly. The elderly are more at risk for hypertension because of reduced compressibility and flexibility of blood vessels. 8. Excessive salt intake. Excessive normal salt or sodium in the diet can result in fluid retention and high blood pressure. 9. Potassium intake. Low potassium diet increases the sodium in the cells due to the sodium-potassium pump. 10. Hereditary. High blood pressure is often familial in nature and runs in families.